Welcome to this Tutor to You Sociology topic video looking at sociological approaches to health. In this video we're going to focus on interactionism. Interactionist views of health focus on the relationships between medical professionals and their patients and look in detail at the ways in which doctors in particular interact with patients based upon their social class, ethnicity and gender backgrounds. They argue that like many other social institutions, the interactions between individuals within that institution influence the level of care that a patient will receive and also influence individuals' perceptions of their own health. Interactionists also examine issues surrounding the social construction of health and how people perceive themselves to be either healthy or unhealthy. They also examine the impact of labelling, in particular on patients with mental health issues, and how the medicalisation of conditions such as depression and anxiety can have negative impacts on patients. Firstly, let's look how interactionists define health. They see health, the body, and illness as a social construction, in part because individuals have their own subjective interpretations of how well or unwell they are. People perceive illness in different ways, with some internalising the diagnosis from doctors of being unwell, whilst others reject symptoms and diagnoses for a wide range of reasons, including cultural background, social class background, gender, and financial necessity. Whilst many people seek out a doctor's diagnosis when ill, some reject this label, whilst others may diagnose themselves as unwell without seeking medical advice. As a result, interactionists see health statistics as being socially constructed. Each statistic is made up of many subjective interpretations of how healthy or unhealthy individuals perceive themselves and others to be. Interactionists are critical of the sick role that is allocated by doctors because illness is associated with a stigma of being weak and vulnerable. This is especially the case, according to interactionists, in the case of mental health disorders. Being labelled with a mental health disorder impacts on how individuals will be perceived by others. While some might have sympathy, others will react in different ways. The interactionist Thomas Sass suggested that mental health can become a master status that many individuals struggle to rid themselves of, and this impacts on people's willingness to ask for help with mental health issues. Whilst this is changing in contemporary society, this is only because of the heightened awareness of mental health issues in the UK, and in other cultures the stigma remains. A further area of interest for interactionists is the way in which disability is labelled, with interactionism suggesting that disability is too a master status that overrides all other characteristics that an individual possesses. Disabled people are perceived by society as helpless, and yet many disabled people are able to live fulfilling lives, work, engage in education, and have meaningful relationships. Interactionists, perhaps unsurprisingly, focus on the interactions between medical professionals and their patients. Goffman suggests that medical professionals are given clinical autonomy to make decisions about the health and treatment of their patients, and this creates a power imbalance between the two. As a result, medical professionals have power over their patients, and this is amplified by differences in status between the medical professional and their patients. Cartwright and O'Brien suggested that these status differences impact on the level of treatment and care that individuals receive, noting that middle-class patients received longer consulting times than working-class patients. Working-class patients were told about treatments, whereas middle-class patients were consulted over different options. This is also present in research into ethnic minority groups and women, highlighting the importance of the role of medical professionals in determining treatments based upon their interactions with patients. Interactionists have been criticised for their view that health is a social construct, with other theorists suggesting that health has a biological basis and that medical advances have impacted on improvements in health across the social spectrum. Furthermore, Arbour et al. in a more recent study than Cartwright and O'Brien, found little evidence of differences in interactions with patients from different social backgrounds, which can be explained by changes in relationships between medical professionals and patients in the 21st century. Indeed, postmodern views suggest that the changing nature of patient and practitioner relationships is a result not only of patients being more informed, but also having more choice over the type of treatments they wish to have. This can be argued to be a result of both increased privatization of medicine and increases in the choice of treatments that are available as a result of technological advancements. That concludes this Tutor to You Sociology topic video looking at sociological approaches to health, focused on interactionism. Thanks for watching.